Welcome to Chapter 11, Career Development from New Graduate to Retirement. This chapter is going to have kind of a two-part approach. First, we're going to talk about the evolution of the new practicing nurse over the lifespan of their career. Then we're going to talk about the role of the nurse leader and the accountability of that leader to develop and invest in the nursing team. The career stages are important, and I do want you to be able to know these three stages as well as to differentiate between them. The promise phase occurs in the first 10 years of nursing employment. This is when the nurse is less experienced, and it can lead to overload. Early career choices are critical during the promise stage. Milestones for this stage include socializing to the nursing role, building knowledge, skills, and abilities, as well as credentials, and an education base. Gaining exposure to a variety of experiences, and identifying strengths and building confidence in the future and positioning for a future position. Momentum is kind of the center field of career stages. It occurs between year 11 and 29 years of experience. This is when the nurse develops expert knowledge, skills, and abilities, credentials, and educational basis. They become an expert. They role model to others. Milestones would include building confidence in one's competence, developing experience, gaining mastery, and establishing a professional track record. You become known for the type of nurse you are. Finding a voice through aligning strengths and passion, becoming a voice that people trust or recognize in an organization. The most significant challenge is creating possibilities for career progression rather than stagnation. So in that center stage, nurses are growing and stretching and finding ways to evolve in their own practice. In this stage, in the momentum stage, it is so important that there be lifelong learning and courage to take risks. Otherwise, professional stagnation occurs. The nurse doesn't grow, doesn't develop, doesn't expand their horizons. And folks, that doesn't mean that the nurse who loves being a bedside nurse has to grow by leaving that position, becoming a leader. You can grow in your expertise at the bedside. So I don't want you to think momentum when we talk about growth. It doesn't mean climbing the chain of command. It means to grow and stretch. If you are passionate at the bedside and you want to be a critical care nurse in an ICU setting until you retire, there's nothing wrong with that. Growth may mean to you adding certifications, adding educational expertise, precepting and mentoring new folks that come on, participating in committees that really look at patient outcomes. There's lots of ways to grow and maintain career momentum in this center stage without having to climb a corporate ladder. The last phase is the harvest phase, and this is the late career. This normally occurs in the 30 to 40 year span. It is viewed as being a nurse who has prime experience and is really seen as focused on legacy building through this stage. In this stage, if the nurse does not continue to strive to grow, they risk being obsolete, and they have to find a way to reinvent themselves and renew their value to an organization. The folks that are in that harvest stage are viewed as sage nurses. They're the ones that everybody goes to for information. One thing that's important for a person that is in the harvest of their career is to find meaning in their career that continues to challenge them. And really focus on what does their legacy look like. So I do want you to know these three phases or career stages and understand how they're different. Career development, these are some general guidelines for you. Career development should be looked at as a lifelong process, and it should involve the individual and the professional environment in which the nurse practices. It should involve the individual and the employer in an active way to grow the individual. It's accomplished through self-assessment, doing a job analysis, seeking education, training, job searching and acquisition, and work experience. All of those things develop an individual. One of the ways that we're looking at early career development in that first vulnerable year of nursing practice is the implementation of nurse residency programs. Many of you right now are beginning to look for jobs, and I'm hoping that some of you are looking at organizations that offer nurse residencies for new graduates. These are individual responsibilities for career planning. Individuals need to be proactive, have a self-evaluation, have goals, examine career opportunities as they come along, prepare for potential opportunities. Education is almost always involved to prepare for potential opportunities, and then to participate in developmental activities. And that may be participating on committees, being part of a shared governance committee, attending conferences. There are things that we do individually that take responsibility for our own growth. It's important to understand that one of the missteps young novice nurses make is not planning early on for long-term goals. And long-term in the beginning of your profession may be 3 to 5 years. Have a plan and have it early so that you can start guiding your professional choices. The manager and the organization's responsibility for career management. I think this is a pretty comprehensive list. What's important to know is that managers should be responsible for planning specific interventions that promote growth and development in each of their subordinates. What's important to know when we think about the planned interventions and promotion of growth, that looks different for each of our employees. The need of one nurse in an area of development may be very different than the need of another nurse to grow and develop. If you have a nurse that is super tech savvy, is all over informatics implementations, always wants to ask the questions and be the first to put their hands on something, how you may grow that person is helping them champion informatics projects, helping support that person seek a graduate degree in informatics and find corporate funding for that. You may have another nurse that gets extremely excited about wounds. I am not one of them. But a nurse that's passionate about wound care. You may want to help that nurse find a path to getting the clinical hours so they can sit for the certification exam for a wound nurse. Each of us have our own gifts and talents, and a good manager individualizes their approach to helping that individual grow and learn. And an organization is going to put their money where their mouth is and put a structured process in place for organizational support to help that manager advance and develop their individual employees. Career coaching is every manager's job. They're going to gather data, they're going to consider what's possible for that individual, and they're going to conduct a coaching session. The goal of a coaching session is to help that person be their very best individual nurse and be at their top of their performance. Short-term career coaching, you're going to have managers that regularly challenge and refocus individual nurses to improve their performance. Long-term coaching should be a planned, systematic approach, at least annually, that looks at ways to help that individual have those long-term career plans, those long-term developmental plans. It's important as they go through, as a manager or a leader goes through this process in career coaching, that they know their individual employee well, and that helps them be an effective career coach. Areas for nursing competency assessments. I think this list is pretty self-explanatory. I'll let you read that on your own. Personal benefits of professional certification. Nurses must meet individual eligibility criteria for any certification exam. Those criteria may include minimum years of practice, types of work experience, minimum educational levels, active nursing license, and successful completion of a nationally administered examination. It is my hope that once you enter practice, you spend the first year or two falling in love with a specialty area, an area that you really are excited about, and that you spend another year really becoming an expert in that area, maybe 2 years, and then you'll challenge the certification exam. That should be your next professional goal as you grow professionally. Certifications typically last about 5 years. And one of the reasons when we look at research about why nurses don't pursue certifications really come back to organizational barriers. Organizations do not often pay for reimbursement of the cost of a certification exam. And certification exams can be anywhere between $200 and $400 depending on which one you're taking. And the organizational support to buy training materials or give you time off to study or take or take the initiative to support your goal to be certified. If you are employed by a magnet facility, and we'll talk about that in a later chapter, they are very nursing oriented and they are very interested in their nurses becoming certified. So know, as you're looking for career opportunities, look for healthcare organizations that value nursing and how they reimburse for certification. This is a fair interview question you can ask. Talk about employee transfers. Lateral transfers are pretty straightforward. You're going to go from one position in a department to another position of department of equal rank and pay. Normally that's done just to find a new experience, a more exciting experience, something that grows you. Downward transfers are a whole nother ballgame. Downward transfers often result in a way to retain the employment of an individual. For example, you have a nursing director who has been a director in the unit for 20 years. They have 3 more years until retirement, and they do not want to retire worn out and grumpy. So they ask for a downward transfer. They want to step down from their leadership position and go back to a bedside position or go to a case manager position. The idea with downward transfers is to retain expert knowledge, to retain qualified, quality employees in an organization and help them find career satisfaction. It is an accommodating transfer is exactly that. It's a transfer that is requested by an employee at their request. Normally that's done for personal reasons. So inappropriate transfers are ones that contribute to decreased productivity. Are they demotivating for all employees? Are they especially destructive for the employee who is transferred? So let's talk about a destructive transfer. Let's say that you have a conflict in your unit and you have 2 nurses who cannot get along. So instead of dealing with the conflict at hand, instead of encouraging them to seek employee assistance through conflict resolution, you decide to transfer one employee from, let's say, the progressive care unit in a cardiac unit to a neurotrauma progressive care unit so that the employees are not working together. That can have a negative perspective on the unit and on the individual who has been taken out of their department and transferred. So you want to make sure that transfers are done appropriately for the positive outcome of the individual as well as the organization. Transfers are not used to manage problem employees, to manage behavioral issues. That's a whole nother chapter. Management development. This is basically what we call succession planning. I want you to read through this. I think this is pretty self-explanatory. Promotion considerations. When you think about promotion considerations, I want you to be thinking about internal promotions versus external promotions. Recruiting for promotions from within an organization can help develop employees to fill higher level positions as they become vacant and serve as a powerful motivation and recognition tool for internal candidates who are exceeding expectations and are seeking the opportunity to grow. So, using an internal candidate who is qualified helps recognize excellence and promotes internally and retains culture, perspective, the nature of a department. An opportunity may arise when you need to promote externally. And here's an example. Let's say that your corporation, your hospital organization is planning to apply for magnet status in the next 3 years. The current CNO is retiring after serving the hospital for 30 years. The last 15 were in the CNO position. So that means that it's been a very stable culture. It may even be stagnant. You have an opportunity, if you're going to do something brave like seek magnet recognition, and you're going to stretch your organization, it may be valuable to go outside the organization and bring in a CNO candidate from outside the organization who will change the culture, because magnet changes everything. So if you're planning on changing everything, you may need an external perspective to change your culture. So ask yourself when you're promoting, are things good? Are things stable? Am I trying to change the culture? Am I influencing it? If everything's okay, internal promotions make good sense. But if there is a change that needs to happen, you may have to go outside your organization and use an external candidate for promotion opportunities. Just be aware of that. And lastly, we're going to talk just briefly about resumes. Folks, resumes are used to get you an interview. Your interview is what gets you the job. So think about it as the front door. You want that resume to be typed in a format that's easy to read. It should be short, sweet, and concise. The style, it should use good grammar, proper punctuation. It should not have any abbreviations anywhere on it. Remember, the first person that reads your resume is not a nurse. It's someone in human resources. So if you use alphabet soup for everything, that person may not know exactly what all of the alphabet soup means. My hope is that you are still writing a resume for your capstone course. If you have questions or concerns about your resume, I'm happy to look at them, sit down and talk with you about your resume before you go in through the application process for a new career. Exciting times, but you do want to step back and make sure that your resume lands on the right desk, and that starts with a good structure, good format, and professionalism.